Hi, well, welcome. Thank you so much for your patience. My name is Helen Lewin. I'm the Programming and Partnerships Manager at Surrey Library. To thank you all for joining us. I'd like to also thank the Community Center and Supported Living Incorporated, and of course, Mass General Hospital in Waltham for partnering with us on this program. I'm going to let Jared and Jacob introduce themselves, and then we will go on with our program. Thank you so much.
Hello, everyone. Thank you for coming. My name is Jakob Hildebrandt. I'm an orthopedic physical therapist working at MGH Waltham.
I'm Jared Maggio, orthopedic physical therapist out of MGH Waltham as well. We did not coordinate on purpose. This is a
Yeah, we just happen to be matching. I think I'll go over here so I can advance the slides as I go. Great. So we'll reserve some time at the end for questions, but if you have any questions along the way, if you need anything clarified, feel free to raise your hand. But if you have more general questions, we'll address those at the end. In this presentation, we're going to cover a few different things. We're going to start by discussing the aging process. What are the changes that occur in our bodies as we age? We begin aging in our late 20s, actually. It's a slow process that occurs over the lifespan and accumulates with time. So we'll talk about how that affects different systems within the body. We'll talk about the role of various different types of exercise on promoting health across the lifespan, and specifically with how that affects aging. So we'll talk about strength training as a cornerstone of this, as well as cardiovascular exercise, so aerobic exercise, balance training, and then lastly, we'll talk about flexibility. So there are different systems that are affected differently by aging. We'll talk about each of these individually. Of course, our joints are affected. Muscle mass is affected. Bones, you may have heard of bone density decreasing with age. Our cardiovascular system, so our heart and blood vessels, have some effects to them. And then our metabolism and our cognitive health, so our ability to process information, and our mental health have some effects on them as well from aging. Let's begin with joint health. So if anyone here, like myself, has ever had an X-ray or an MRI or any kind of a scan, you're sometimes going to see the words degenerative changes on there, which sounds negative. In reality, we can think of that as wrinkles on the inside. Just like we have external changes in our appearance, we have internal changes in our appearance. So you might see medical terms like osteoarthritis, or with the spine, you might see words like disc desiccation or facet arthropathy. These are normal changes that occur with time, but if they become exacerbated or if they advance to a certain extent, they can become problematic. So you can experience things like joint pain, decreased strength, sometimes related to that pain. You can lose flexibility in joints, and in some cases you might have a need for surgery, like joint replacements and that kind of thing. The fortunate thing is exercise can help improve that joint health. It can improve the lubrication of joints. It can reduce swelling and pain in those joints, and it can improve the strength of the joints as well. Well, Jared, go next.
So in relation to our muscles as we age, there's this term sarcopenia, which is basically the age-related loss of mass and strength in our muscles. It's the size of our muscles, and the fibers that make up our muscles do decrease. It makes it harder to get stronger as we get older, essentially, right? So that means exercise is that much more important as we age. Why it matters is pretty self-explanatory. Functional tasks, getting around the house, getting off a chair, a bed, a low couch, things that people come to us often for. Community mobility, so walking around buildings like this where there's stairs, curbs, uneven sidewalks, and fall prevention, a big one that sends a lot of people to the emergency room. We like to try to prevent before you even have to get there. Fortunately, as this whole presentation, Jacob already said, exercise really helps to slow and sometimes even reverse some of these processes. Muscle strength, muscle size, muscle endurance can all be affected by our exercise, right? So things that we already kind of know. Now, bone density. Now, this is an issue that almost everyone has to deal with as you get older. A lot of things affect it because there are specialized cells in our body that are constantly building and breaking down. When the breaking down surpasses the building of bones, we have osteopenia and osteoporosis. Osteopenia is the lower form of osteoporosis, meaning osteoporosis is that more advanced form. Just a show of hands, has anyone in here been diagnosed with osteopenia or osteoporosis? It's quite common, more common in females, a lot of causes in there. Hormonal changes like menopause, obviously, we stop producing vitamin D and calcium. Diet lacking in calcium and vitamin D, a lack of exercise, one of the most modifiable things out there, medications, disease, and genetics. So where it really matters, low bone density increases your risk for fractures. So if you fall and you have low bone density, obviously there's error there. Exercise is one of the quickest and easiest ways to affect any osteoporotic condition. So we like to, again, go into those activities as soon as we see that. Can our bones grow stronger? Yes, that's the quick answer. There's those osteoclasts and osteoblasts again. Osteoblasts, they help build the bone. Osteoclasts break it down. As we put force on our bones, the bones respond the same way muscles do, just in a slightly different format. So if you put stress on a bone, it becomes more dense. It's why our heel bones and our leg bones are more dense than the bones in our hands and our wrists. Okay, that's Wolff's law. The more stress you put on something, the stronger it becomes. Bending of bones, as we call it here, is when you perform certain exercises in the upper or lower extremity. They pull and tug on the bones themselves, and that also increases the density of the bones, making them stronger. So doing some resistance training, resistance exercise also grows the bone. That's what we're looking to achieve when we exercise, not just low impact, but a good fatigue through the muscles that grow the bone strength. So our cardiovascular system, that's a big one at play here. Cardio, something we're all kind of familiar with, a lot of ways that it kind of changes with time. Arteriosclerosis and atherosclerosis, often kind of used interchangeably, but a little different. Arteriosclerosis, hard to say, mouthful, is when the arteries and the walls of our hearts, they become a little thicker, a little denser, harder to move. Atherosclerosis is the actual plaque that builds up within the arteries and the capillaries in our body. This will change the valves on the walls of the heart and can create abnormal heart rhythms, obviously can create hypertension, blood pressure issues. We want to try to slow that down. Why that matters: if you have poor cardiovascular health, that can lead to heart attacks, stroke, and arterial insufficiency, meaning low blood perfusion throughout the body. Exercise is the most direct way to make changes to this. Right, so we've kind of grew up learning about this. I think everyone's comfortable with this idea that if you have improved cardiovascular function, your blood pressure decreases, you have improved heart rate, and you can decrease those lipids, those fatty acids that increase the plaque buildup in the body. Metabolism is one more thing that we kind of touch on here. Metabolic rate, that's the way our body processes energy. That does decrease with age. I'm definitely a victim of this, as most people are. As we get older, it's harder to lose weight. It's harder to maintain the same level of fitness that you once did, and that's our metabolic rate decreasing. Muscle mass is a big contributor to that. The more muscle you have, the more energy you burn, because your body is trying to keep those muscles healthy. It's trying to keep blood flow pumping through them. When your metabolic rate decreases, it can lead to things like diabetes, type 2, and cardiovascular disease. Again, exercise, one of the best ways to increase muscle mass, which then increases your metabolic rate, and it improves your insulin sensitivity, which helps to manage diabetic conditions. So those are big, big factors there in our metabolism. And lastly, a big one that has gained more popularity and more recognition recently is our cognitive and mental health. Okay, so as we age, we have a decreased ability to pay attention, decreased working memory, decreased ability to multitask, and difficulty with word finding and recall. Okay. On the flip side, I really like this. Jacob put the slide together, so kudos to him. Increased wisdom, which I think you can all appreciate that. Increased knowledge, increased happiness. That's proven in the literature that as we age, we do become happier. And decreased stress, worry, and anger, hopefully, so long as life is going well. Exercise does help with some cognition and mental health. It increases neuroplasticity. That's the brain's ability to build neural connections. Okay, so the more you exercise, the more blood flow through the brain, the more connections are going to be made. That improves your cognitive function, including memory and executive function. So high-level reasoning, right? Doing those high-level processing issues. It counteracts neurodegeneration, so slows the degenerative process of our brain and helps to decrease our anxiety and depression.
So we've talked about what these effects of aging are and how exercise can help with them. Let's talk about what we can actually do to do that. And I'm going to show you this next slide. Will reveal the fountain of youth. Here it is. Very simple answer. We have guidelines from the U.S. Department of Health and Human Services also mirrored by the guidelines from the American College of Sports Medicine. They have a very clear answer for what's the right amount of exercise to be doing to ward off a lot of adverse health outcomes like cardiovascular disease, all these other negative effects on our musculoskeletal system, all these other things we talked about. Turns out if individuals do 150 minutes every week, not every day, of moderate exercise, aerobic exercise, or for those people that prefer to work out harder. So, moderate exercises like going for a brisk walk or riding a bicycle on a relatively easy setting. For people that prefer more vigorous exercise, 75 minutes a week is enough. That's for some people, that's like running or working out really hard on a stationary bike, or swimming quickly. That pretty much covers your basis for aerobic exercise. The part that's often left out is this other part of this graphic, which is muscle strengthening. Twice a week, we want to be doing some muscle strengthening for every major muscle group in our body. So shoulders, chests, back, lower legs and all that. In reality, not a lot of people actually meet these requirements, which is part of the reason we have, relatively high incidence of a lot of cardiovascular disease and other negative outcomes from lack of activity. But if you just meet these benchmarks, that goes a really long way towards improving your overall function. And we'll talk specifically about how do we achieve these things? How do we get these 150 minutes or 75 minutes, and how do we strengthen those muscles twice a week? So let's begin with strength training. Strength training has enormous benefit to our overall well-being and our health. First and most obvious is strength. That's why we call it strength training, builds strength. As a result of that, it improves metabolism as well. When we have more muscle mass due to strength training, we burn more calories at rest. And just doing that exercise in and of itself is good for the metabolism on a biochemical level. As Jarrett mentioned, it also improves our bone density. This is very important, especially when we start thinking more about things like fall risk and those kinds of things. Joint health, also one of the primary interventions we have in physical therapy for osteoarthritis and joint problems is strengthening. Not a single patient comes to our clinic that has a problem with a joint that isn't doing some kind of strengthening for that joint. And lastly, of course, some real benefits on cognition and mental health. So one of the biggest mistakes people sometimes make with strength training is they miss out on this part of it, this concept called progressive overload. Even if somebody's doing a great job doing their strengthening twice a week, they're continuing to do more or less the same intensity of exercise, it's hard to develop and get stronger, right? So what we want to do is gradually increase the difficulty of exercise if we can. And that's a big caveat we'll get to in the bottom part of the slide. If we're in a position where we can, we want to gradually, if we're using weights, use slightly heavier weights over a long period of time, or do more repetitions, or find a more challenging exercise. Now, there are going to be times where you've pushed hard for a while and you just can't progress for a period of time. That's normal. It's very important not to push through that to the point where you're causing pain to certain joints. And lastly, we do have to recognize that with aging, there is sarcopenia that accumulates over time. That's that loss of muscle mass. So we may reach a point where we are more in a maintenance phase. We're just doing the same intensity for a longer period of time to just try to maintain the strength that we have. That's a normal part of the aging process that we have to accept. But if we're starting with a new exercise routine and we haven't done that much strengthening yet, often we can still build a good amount of strength for a period of time, even if we have some significant sarcopenia.
So where do you start? What type of exercise do you begin with? That's one of the bigger questions we get, especially when we start to let people go out on their own. When it comes to exercise selection, we have three main priorities. One, it should be pain-free. Okay, they need to be well tolerated or you're less likely to do them. That's common sense. It also helps to avoid injury. If you have pain with an exercise, stop that exercise. Find something different. If you're working with a trainer, let them know. If you have pain that's not getting better, let your doctor know. You'll see me or Jacob, right? So that's where PT can help. Motivating. The exercise should be enjoyable, right? So select exercises you like to do, ones that you're willing to do regularly. You want to be able to show up and be excited about it, get outside for a walk, Go with a friend, go with a trainer that motivates you. And then 3, that stimulus Jacob kind of touched on. You want to make sure you're placing enough load on your body to make changes, which we'll go into a little bit more what that really means. So you can select different parts of the body. We divide into 3 regions, either lower body from your hips down, core, which is not just your 6-pack, but all the way around to the spine as well. And then upper body. It's your chest, your arms. You could include neck in there as well because they do cross over, but it's really everything from kind of chest up, okay? So programming. How often should we be exercising? The minimum should be 2 or more days a week. At 2 days a week of exercise, you'll maintain where you are. You won't get any worse, you won't get any better, you'll stay where you're at. And if you're at a good spot, that's great. Generally, we shoot for a little more than that. So you want to choose a difficulty that you can sustain multiple times a week. Choose a difficulty where you can barely complete the sets by the end of the 3 sets. This is all the repetitions by the end of the 3 sets. Okay, so when you're counting repetitions, you try to do 3 to 5 sets of 5 to 12 repetitions. Pretty large range there, and that's for a reason. If you're on the lower end, say you're doing 3 sets of 5 reps, that's generally for more focused strength training. You want to get stronger quads. You want to be able to get up from a chair easier. You want to practice 3 to 5 sets, pretty heavy resistance training. If you're doing 5 sets of 12 repetitions, that's going to be more for your endurance tasks, right? So say you want to go for walks or you want to be able to unload the groceries easy or something like that. You want to be able to do a lot of repetitions at a light weight. So 5 sets, 12 repetitions would be more appropriate. Finding that range is based on how comfortable you are, how you feel, and maybe working with someone to help kind of coordinate where exactly you land there. When it comes to lower body strengthening, we like to start with some very basic but large, we call compound motions, where you're getting a lot of muscle groups all in one action. The squat has a lot of different variations. We ranked it here from easiest to hardest. The beginning one being a mini squat, going all the way down to a body weight squat with weight. Mini squat is holding on to something, right? Just very generic, basic, up and down, small motion. Then you can go to a sit to stand. That's getting up from a chair and not using your hands. Okay, if you can do that pretty well, then you go from a high surface to a lower surface or a normal chair height. So you can start maybe at a chair with a couple of towels on it, take away a towel as you get stronger till you can get up from a chair with no support. Once you've mastered that, you go to a chair squat where you're just touching the chair but not actually sitting. Then you take the chair away, you're doing a full squat, and then you can add weight to that, okay? Similar progression with the lunge, a little more advanced, where you're splitting your stance between 2 legs. So I'll kind of get in front to show some of that. And you can start with a little forward step with your foot on a step where you just come up. Then you go down to just a partial squat. Then you go a little lower to a full squat. And then some reverse lunges, which is more starting forward and coming back, or going into more of a lateral motion. All right, so more dynamic motions as you get further down. And if nothing else, just add weight to what you're doing. Grab a couple pounds, grab a couple soup cans, grab what you got laying around, and you can practice some of these motions here. Did you want to go over any of these as a practice, Jacob?
Does anyone want to try out just a sit to stand? Get a little stretch going in the middle of this talk. I know it's been about 20 minutes of us just talking, so why don't we all take a second? Just if you need your hands to stand up, you can do it that way. If you feel you're able to stand up without the hands for assistance, that's another way. And so however much you feel comfortable doing, just try a few rounds. If you feel like your leg strength is pretty good, you can try what's called that chair squat. Just make sure the chair is actually behind you and trying to touch the chair. You can kind of test that out and take a quick stretch break here. Safety is always the most important thing. So anytime you're exercising, do it in an environment where, yeah, so that's a sit to stand without using the hands.
One tip we try to teach people, keep your legs wide. Not so wide that you feel unstable, but wider than you think. If they're narrow, you're going to be unstable. I like to use the term Eiffel Tower, right? Wide base of support, that's going to give you more stability when you do one of these. All right, if you're too narrow, you'll feel a little wobbly. Your legs will come together a little bit.
Yeah.
That's great.
Excellent.
That's
Great.
perfect. So we usually use that sit to stand as a great middle of the road exercise to see where people are at. And we can usually gauge someone based on how they do this type of exercise. Should we make it harder? Should we make it easier? And you can tell if you're not comfortable going to the chair, you may need to start with a little higher surface before you go to a full chair squat. All right, great. Then with the lower extremity, with the lower body strengthening, you could also use machines. So this is if you have access to a gym, using something like a leg press where you're pushing the weights away from you. You're nice and stable. You can hold on to something and you can adjust the weight based on that. Leg extension machine is the one where you're sitting and just kicking your leg up. And the hamstring curl is where you're sitting or maybe even laying down and bending your knee against resistance. Those are great ways to strengthen those muscles. It's a little more isolated, not as total body as the squat and the lunge, but a great starting point if you're at a gym and you don't feel super comfortable doing just these squatting maneuvers on your own.
Okay. So there are a lot of options, both for leg strengthening and for core strengthening for all of these really. So we have just presented 2 potential core exercises. These aren't the right ones for everybody. Same with, leg training. If you have another form of leg strengthening that you like, that's completely all right. We just wanted to give a couple of examples of helpful core strengthening exercises. So one is this all fours sort of position. This one isn't for everybody because for some people it bothers their wrists. There are modifications we can make to that because as you can see this person right there on all fours, they have their hands down. For some people, they can't quite get that mobility. Doing it with some hand weights under your hands, for instance, makes that a little bit easier for people because we have more of this kind of an angle. There are modifications we can make to this. But the easiest place to start with this exercise is just on all fours and just arm lifts, reaching one arm up, then reaching the other arm up. If that is easy and you have a really stable core, you're not shifting around a lot, doing a leg lift is a lot harder than lifting the arm. Our legs are a lot heavier than our arms. And then this person's doing a combination. Quite challenging. They're lifting the opposite arm and leg, so there's a little bit of balance involved there as well. Another alternative is a plank. You don't even have to start anywhere near this. This is the 4th step in this. So you can begin with your hands on a counter and just, putting a little bit of tension through the core that way. If that becomes easy, you can do it on the floor on your knees and elbows, for instance, or on the feet and the hands, and then progressing to the feet and the elbows. Again, there are a lot of different variations, but these are just a couple of examples.
How long do you hold those stretches for?
Great question. So generally with a plank, because this is a plank that you just hold for a certain period of time, anywhere from like 15 seconds to a minute, depending on what is challenging for you. If you can't quite do it for 15 seconds, you might want to maybe choose an easier exercise. If you're going for longer than a minute, maybe you should choose a more challenging exercise. This one here, we usually do for repetitions. So similar to the repetition schemes we had earlier, maybe 3 sets of 10 or something like that. If anyone's ever been to PT, your therapist is probably always telling you to do 3 sets of 10 or something. We choose that because it's a good middle ground for amount of repetitions and sets. It's easy to remember, but that's how you would do these ones. For the upper body, we want to make sure that we're doing some kind of a combination of pushing exercises and pulling exercises to train opposing muscle groups. We have muscles in the chest that help us push and in the back of our arms, and we have muscles in the back that help us pull as well as in the biceps. And then we have stabilizing muscles in the shoulders that help with that. So if we just do one of each of these, that's a pretty good way to cover a lot of bases for strengthening. So an example would be for a chest press, an easy place to start is a wall push-up. Go to a wall, do some push-ups like this. If that gets easy, you can move down to a countertop, which is a little bit lower, more challenging. And then you could do, a kneeling push-up or a regular push-up. For other people, they prefer to use weights. If you have hand weights at home, you can simply lie on your back and press them up towards the ceiling. And then you want to make sure you're doing the opposite motion of that as well. The tricky thing about these, they're called rows because it's like you're rowing a boat. The tricky thing about them is usually you have to have some kind of a prop. Unlike these where you can do them with your body weight, you need to have like an elastic band to pull on or a hand weight or a machine that you can pull on. So with that, you need some kind of equipment, either a little hand weight or a heavy hand weight for that matter, or an elastic band or a machine. So to review, if you wanted to keep it really simple, you could do 4 exercises to cover every major muscle group, just like the ACSM recommends. Twice a week, every major muscle group. If you did either a squat or a lunge, you did one core exercise, one type of pressing movement, and one kind of a pulling movement, you could cover all those major muscle groups as long as you're training them hard enough. You're doing enough sets and enough resistance to challenge yourself to the point where maybe you feel a little bit of fatigue doing, and maybe you even feel a little bit sore in the muscles the next day. Generally, if your muscles are sore the next day, that's a good sign that they're growing stronger. If they're too sore, it's a pretty good sign that maybe you want to go a little bit easier because you're probably not going to enjoy it very much if you're really sore every day, right? Then in terms of the number of repetitions and sets, you have a lot of leeway here. Again, like Jared said, you could do as little as 3 sets of 5 that are very, very strenuous, or as much as 5 sets of 12 of something a little bit easier. Or you can kind of mix and match. You could do 3 sets of 12 or 5 sets of 5. It doesn't matter that much, as long as it's something that you can keep track of and that you enjoy doing. This is really important. Remember to rest in between. This is something that happens often when I prescribe patients, and this is on me, exercises that are maybe a little bit too easy for them. If I give them 3 sets of 10, and they come back the next time and they say, I did all 30. I said, how did you do them? All in a row. That's 1 set of 30, not 3 sets of 10, right? So that exercise is way too easy for that individual because each of those sets should be challenging to the extent where they have to rest a minute or 2 in between, right? So we want to make sure we're doing it in a way that's difficult enough and in a way where, well, we give ourselves that rest time in between.
So we have cardiovascular exercise. So the benefits, again, kind of an overview here, but we've got a lot. Obviously, cardiovascular health, that's your heart, your blood flow, cognition and mental health. Better blood flow to the brain means better cognition. Okay. There's even some research showing that it's helping fight some dementia-related changes as well these days. Metabolic health. So keeping the metabolic rate high is important as we get older so we can process more calories more efficiently, keep our weight healthy, and keep our blood pressure healthy. And then bone density. It's a little lesser extent than strength training, meaning strengthening is going to be more effective for bone density, but still valuable, especially if you're doing things like walking. Swimming, not so much. Exercise selection, there's a ton, and there's many more, right? So cardiovascular exercise should be something that gets your heart rate moving for an extended period of time, and that can be anything, really. The most common ones are walking, stair climbing, jogging, aerobics, swimming, biking, hiking, elliptical, and dance. I will say the one caveat with walking, which we see a lot of, is people say, oh yeah, I do cardio. I walk about 20 minutes every day, maybe twice a day. I'll say, okay, great. So how do you feel when you're walking? Are you out of breath? Are you checking your heart rate? Are you really going for time? Or are you just doing a loop around the block with a family member? And most people aren't that exact about it, because why would you be? But if you are curious, you should be trying to get your heart rate up to a certain level. You know, there are formulas out there based on your age that you can look up. What should my target heart rate be for cardio? What should I be going for? And that's going to be different for everyone. But if you can really get yourself moving maybe a little quicker than just a light walk, you're probably going to do yourself some good as long as it's safe. The programming. So how often should you be doing this? Minimum 3 times a week. Cardio, you can do up to 5 times a week if you're feeling like it's pretty doable. 3 times a week would be the bare minimum to see improvement. So once or twice a week, you won't really get anywhere. 3 times a week, you'll slowly improve. 5 times a week, you'll be feeling really good. A total of 75 minutes or 150 minutes per week. Okay, so 75 minutes of high intensity exercise like jogging per week is recommended, or 150 minutes of moderate intensity like a brisk walk. And that's that faster walk I'm talking about, not just a casual leisurely walk, which is good for you, but it's not going to get you the same benefit as a nice brisk walk where your heart rate's getting a little elevated. Almost everyone has some way to check their heart rate, right? We've got these fancy watches now, Fitbits. If you're not into that, calculating your heart rate's pretty simple. You find your pulse, calculate over 15 seconds how many beats you got, times it by 4. That's your heart rate. Okay.
So I haven't talked about this much yet, but a lot of the strength training, especially for the legs, one of our main aims with this is also preventing falls. Strength is incredibly important for fall prevention. We have research that shows the speed with which somebody can do that sit to stand exercise that we were talking about relates to their risk for falls. The reason is, catch our toes sometimes. in order to recover from that, you have to be able to step, and then your leg has to be able to stop you from going to the ground. So leg strength is super important. So strengthening the legs goes a long way towards preventing falls, but we can also do more specific exercises. In physical therapy, we evaluate somebody's function and along a couple different paradigms. We look at their ability to react to, perturbation. If you suddenly have to turn your head, or if somebody runs into you, your ability to react to that. We look at, how's your sensation in your feet? We look at all of these things to determine what would reduce your fall risk. Here are just a couple of examples of simple balance exercises that anybody could do to hopefully reduce their fall risk. We'll talk about a couple specific exercises, but in general, if you don't want to do these two specific exercises that we're going to talk about, there are a lot of activities that incorporate balance, things like Tai Chi and yoga that people enjoy. That could be a good option as well. You don't necessarily have to do these exercises. And for anybody that's seriously concerned about their fall risk, maybe you've had a couple near misses recently or a fall, it is helpful to have a professional evaluate you, have a physical therapist take a look and to see what's going on and what you can do about it. Here's a progression again of exercises. For most people, with their eyes open, just standing with their feet hip width apart is a good place to start. Most people can do that pretty okay without wavering too much or losing their balance. That's not everybody. Some people have to start elsewhere, but most people start there. That's easy. Feet together, maybe a little bit more sway. Then one foot slightly offset from the other might be a little bit more challenging. One foot in front of the other. Usually this is where people start to feel a little bit unsteady. And then certainly standing on one foot is a challenge for a lot of people. I mean, think about when's the last time you practiced standing on one foot. In a lot of cases, it may have been a while ago. And then you can do something more challenging, like standing on an unstable surface like this foam pad depicted here. So another thing you want to keep in mind, for some people, it's helpful to practice also balancing with your eyes closed, because we tend to rely on vision more for our balance as we age. So, you might be out in a setting where there's lower light, getting up in the middle of the night. Maybe you don't have a lot of night lights around that help illuminate things. Important that you can navigate without relying fully as much on your vision. So, for when you do that, though, you might have to select an easier stance. So, for instance, if you can stand on one foot with your eyes open, you might have to stand with both feet together with the eyes closed.
Would it be a good idea to start with the chair near
Yeah,
you?
great. So that was going to be
Yeah,
absolutely. So my next point, I think we have it on the slide. Safety first, right over there. Really important to do it somewhere where you know that you can recover if you lose your balance. So having a chair nearby. Often I recommend that people maybe do it next to a countertop where they can reach out if they need to, or like in a corner, right? If I have both of these walls next to me, I'm not going to tip over because I have the wall there. And then maybe I even put a chair in front of me. That would be a really safe way to do it. The thing to note about that, though, so if you have that countertop, if you're standing on one foot and you're kind of doing this the whole time, right, using the hands for balance, you're not training your ability to stand on one leg. You're training your ability to do this to balance, right? So you want to maybe make it a little bit easier to where you don't need to be touching the countertop the whole time. And especially this doesn't count because that one finger is doing a lot for my balance. I'm just learning how to balance with my finger instead of my foot, right? Another thing is traction, right? Don't do it on this kind of a floor. I wouldn't wear socks. I would do it in a shoe or barefoot. You want to make sure you have good traction. On carpeting, you can get away with socks usually. And then you also want to make sure you're holding these for long enough. So if you're choosing a stance that you can only do for 5 seconds, do something a little bit easier so you can hold it for longer and really train your body's ability to do that.
Right, so we're gonna finish off with some flexibility exercise and stretching. So It's my own personal bias, but I'd say if you're stretched for time and you don't really have hours in a day to do exercise, this is probably the least of the concerns when it comes to health and fitness. We use stretching as a means to get someone either to their normal and their baseline or to feel good. Okay. There's some common areas to stretch that most people could benefit from, but I'd suggest that if you're going to stretch, either find the areas that are tight or maybe consult someone who can take an evaluation of you and say, you're tight here, you should stretch. Many people come to us, they're stretching a ton. They may or may not even need to. So we like to look for what's tight before we start stretching everything. All right. That's where the personalization comes in. Find the things that need to be stretched, then stretch them. The common ones we see, hamstrings, calves, and pecs. All right. So the hamstrings are the back of the thigh here. A lot of ways you could do that. We'll get into some pictures in a second. The calves are the lower portion of the legs there, back of the leg, and the pectoralis up through here. They often get pretty tight as we age because of our posture. We usually don't grow taller as we age. We eventually kind of round and get a little tighter. So stretching that out can help get our shoulders back, making it easier to do some rowing, making it easier to stand up tall. Same thing with the hamstrings and the calves. They often get tight if our legs are a little bent when we start walking, or if we have a little arthritis in our hips or our knees, that can often get pretty tight. Duration, similar to balance, you want long duration, 3 times 30 seconds, minimum 1 to 2 times a day. If you're really tight and you're in therapy, we'll have people stretch 4 times a day if they really need to. But if this is just for general stretching, a couple times a day of calf and hamstring are great. You can fit them in throughout the day. Waiting for the water to boil, you can stretch your calf, right? You wake up in bed, you're a little tight, you could do a little hamstring stretch just like that. So these don't need to be too cumbersome or take up a lot of time. The common stretches we're just talking about here, hamstrings, pec, and calf. There's a lot of variation to all of these. These are just some examples. Calf stretching with your hands up against something on a counter or a wall with the stretching leg behind. Very common one you see, we call it the runner's stretch, okay? Hamstring stretching, you could do this all sitting in your chair right here. Very easy. If you just put your legs straight out in front, keep the legs straight, so no bend in the knee. It might need to scoot forward a little bit in the chair to do that. And then you just reach forward towards the toe, but keep the knee straight. You should feel a little stretch in the back of the leg, all right? If you don't feel a stretch, you might not be tight in your hamstrings, so you might not need to do that. But if you feel a little pull there, or if it hurts, that might be an indication that you can get there. And then pec stretching. This gentleman's laying down to stretch his pecs, but you could do this sitting in a chair just the same. If you put your hands right behind your head, sit up nice and tall, and just open up those arms, maybe do a little bit of a lean back, you should be able to feel a gentle stretch across the front of the chest there, okay? If you feel pressure in your back, don't lean back, okay? That might just be pinching a little bit back there. So you just want to open up those arms, okay? But another common variation, you'll see people step in a doorway, stretch their pecs like that, or maybe do one arm at a time with their arm on a doorway leaning forward. All right, so I think that's all we got.
Yeah.
So thank you.
Thank you for your time.